everyone, my name is Praveen. Today I and my teammates will explain you about dengue, where most of us will thinking dengue as not a serious disease, but you know no, dengue will make a most serious and can cause death. Where nowadays Malaysia statistics show that almost 101,000 dengue cases will be reported in one year, and most of them, which is 50,000 almost, are from Selangor, which is our capital city. Do you know how to prevent dengue? Do you know what causes dengue? Do you know how we can diagnose dengue? Let's see in the videos. We will explain you one by one. Now, what can cause dengue? Where dengue is from a mosquito disease, which is known as zoonotic disease, is caused by a mosquito. Where it's only a type of mosquito which is known as Aedes aegypti, which is a female mosquito only will can cause dengue. Where male mosquito normally won't take blood from human, but it's love to take juice. Let's see what is the sign and symptom, pathogenesis, diagnosis, and prevention of the dengue in the next slide. Thank you. From
my name is Adi, and now I'm gonna explain to you about the sign and symptom about the dengue fever. Usually, most of the people are mistaken that dengue fever and the normal fever are quite similar to sign and symptom, but the odd things about them is that dengue fever will only last long until more than 7 days, and the normal fever is gonna the person itself will take 3 to 4 days to recover the whole symptom. So there's a lot of signs and symptoms that I will show to you guys, which is the first one we're gonna see here is that this person has a very bad dehydration condition, which is because she will have amnesia, will have a headache or something. So let's move to the next person, which is dengue fever really have a really high fever, and the temperature can exceed more than 43 temperature. And when she's having a bad fever and a high fever, it will cause her to have a vomiting symptom also. The last person, the most painful symptom in the dengue is the muscle pain, joint, and all those muscles in her body constrict and make her pain much more. And the other symptom is to have like a rashes. As you can see, she is being itchy too. And then that's the sign and symptom that will cause the dengue and fever, which is the doctor itself will diagnose with those kind of signs and symptoms that will last longer than 7 days. That's how we diagnose the dengue virus. So that's it from me. Thank you.
Oh, a mosquito just bit me. So, do I have the chance to get dengue? Probably. Why? Because when a mosquito bites into a human skin, it injects the virus into the skin. The virus then hijacks the cells and replicate. So the virus of dengue fever is then 1, then 2, then 3, and then 4. So the virus then goes into the lymph node and initiate inflammatory reaction. And then the virus then goes into the bloodstream and causes cells of the bloodstream to become permeable. This then causes bleeding under the skin, frequent vomiting, and abdominal pain. So the severe bleeding will lead to shock and death. That's it.
Hi everyone, now let's see about the life cycles of the dengue virus. As early my friend mentioned about, the dengue virus can classify into 4 categories, which is Dengue 1, Dengue 2, Dengue 3, and Dengue 4. Where not all the female mosquitoes do not contain dengue virus. But some female mosquitoes that contain dengue virus will bite a human, that will cause dengue fever in a human, where it can lead to death, but already mentioned in before pathogenesis one. When a normal mosquito bites an infected person mosquito, the normal mosquito will have the dengue virus, where the dengue virus from the human will be transmitted to the normal mosquito and replicate over there. That's the life cycles. Thank you.
Okay, dengue test kit will help to detect the antigen, which is part of the virus which can be detected by from the blood. And there's also antibody, which is antibody IgG or IgM, which are against the dengue which can help to detect the antibody against dengue virus. So from this test, if there is positive results, means that you have the dengue fever. There's also another test, but it is not confirmatory like the tourniquet test, which can also use to detect dengue hemorrhagic fever. And that's all from me.
Hi, I'm Kitish. I would like to talk about the treatment for the dengue fever. So first, usually it's not the medication is given not to just prevent the dengue entirely, but doctors will suggest the medication to suppress the signs and symptoms. For example, for the fever, the doctor will suggest acetaminophen. It's a type of antibiotic to cool down the fever and the inflammatory systems. And for the second thing, due to they have muscle pain, joint pains, usually the doctor will suggest Motrin or Boston to relax the muscle pain. And then for the vomiting, nausea, the doctor will suggest Malox, which is to prevent the vomiting and the diarrhea symptoms, and probiotic as well for the diarrhea. And lastly, to prevent the abdominal cramp of the patient, the doctor will suggest Buscopan. It's a type of tablet. It's given to relax the abdominal cramp. So these are the medications that's usually given to the dengue patients to suppress the signs and symptoms, because dengue is usually it has its own recovery period. So to not prolong the dengue fever, the doctor will suggest all these medications meanwhile until it reaches the recovery period.
Just look at this pool. Did you know that actually Aedes can breathe inside the water? So hi, I'm Arwin. So today I will be explaining about the prevention of dengue. So first thing first, is to actually to remove all the water inside the containers and coolers, because actually Aedes can breathe inside water. Secondly is to wear a long sleeve t-shirts whenever you go out the house. It's actually to prevent us from mosquito to bite us. Third is actually to use mosquito repellent whenever you are inside your house to kill the mosquitoes. And last but not least is to use a mosquito net inside your house. So remember this guys, prevention is better than cure.